My work here is done. I've done all I can do. It's time for the next caregiver to step in and continue the care of the patient. I need a tool to communicate effectively during this transition of care. Aha! There it is, the I PASS the BATON tool. It's just the tool I need to communicate important patient information to the next caregiver. So, I PASS the BATON works like a checklist. It ensures that caregivers convey the same information in a structured format every time. Now join us in the emergency department to see for yourself just how easy and effective the I PASS the BATON tool really is.
Hello, Dr. Bonsu. Thank you so much for coming down to the ED.
Thank you. Thank you for organizing the patient information for a good transition.
Absolutely. Well, now that we've introduced ourselves to each other, let's get started. So, patient is Mr. Sanders. He's a 63-year-old male who is in room 3 down here in the ED. He came in with 3 hours of chest pain. He had some nausea with it. His EKG was within normal limits. It did show sinus tachycardia, but no acute ischemic changes, and initial troponin was negative.
Okay.
I did load him with aspirin and gave him some sublingual nitroglycerin with improvement in his pain. He has a moderate heart risk score, and he's never had a cardiac workup before, so I think he needs to come in for rule-out ACS.
Okay.
He has full code. He's currently chest pain free, and his pain improved after sublingual nitroglycerin. Tachycardia improved after pain control as well. His troponin and chest x-ray were normal. He lives alone, he's not a fall risk, and he has no known drug allergies.
Okay.
He has a history of type 2 diabetes, hypertension, and hyperlipidemia. He's on atorvastatin, lisinopril, and metformin. We did trend his EKGs, and we didn't see any new or evolving changes.
Good.
But I do believe he requires further cardiac workup, including stress tests.
I agree.
All right. His repeat troponin is ordered and pending.
Okay.
His daughter is the next of kin, and she's currently at the bedside. I would just watch for his repeat troponin, which is ordered, and call cardiology if indicated.
Thank you very much. I'll take it from here.
Thank you.
See, didn't I tell you? Look how smooth that patient handoff went. The I PASS the BATON tool is the best tool to ensure that pertinent information is not missed during the patient handoff process, and that the next provider has all the information they need to safely care for the patient. When you are assuming the care of a patient, ask for the I PASS the BATON if it's not offered. By doing so, we can hold each other accountable to safe patient handoffs. Oh look, here comes a courageous caregiver now. I'm going to give her the I PASS the BATON, so she has the information she needs to safely care for the patient.